sodium ion value, potassium ion value, and we can measure chloride value. Topic for your Viva exam. I am telling you again, please read this very carefully. Understand? This is one of the most favorite topic for examiners to ask questions in Viva exam. Everyone should be aware of these terms. What is pH? pH is negative logarithm of hydrogen ion concentration. Normal range is 7.35 to 7.45. Here is written something wrong. Please correct this. So normal value pH is in our body 7.35 to 7.45. Everyone should remember this. When less than 7.35, that is called acidosis. When more than 7.45, that is called alkalosis. Okay, PCO2, that is called partial pressure of dissolved carbon dioxide in our body. Okay, normal value is 35 to 45 millimeter of mercury. Okay, when it is more than 45, that is called acidosis. PCO2 denotes respiratory part. Respiratory. Where bicarbonate, it is denote metabolic part. Metabolic part. When more than 45 PCO2, that is called respiratory acidosis. Understand? Respiratory acidosis. When less than 35, that is called respiratory alkalosis. Everyone should remember these terms. PCO2 denotes respiratory part, where bicarbonate denotes metabolic part. Normal value 35 to 45 millimeter of mercury. When more than 45 millimeter mercury, that is called respiratory acidosis. When less than 35, that is called respiratory alkalosis. Bicarbonate, normal value 24 plus minus 2, that is 22 to 26 millimole per liter. Okay, when less than 22, that is called metabolic acidosis. And when more than 26, that is called metabolic alkalosis. Understand? Any question? Any confusion? Any confusion? কি বুঝতে পারছো না? 26. Metabolic. Alkalosis. Acidosis. This is normal. This is a very basic concept. Please focus here. Acidosis. Acid means they donate protein, donors of proton, pH less than 7. Bases means proton acceptors, pH more than 7. Strong acids mean acid which ionize completely, like hydrochloric acid, sulfuric acid, etc. Weak acids means acid which ionize incompletely, like carbonic acid, H2CO3. pK value means pH at which the acid is half ionized, where salt is to acid or is to 1. Alkali reserve means bicarbonate available to neutralize acids. Normal value 24 millimole per liter plus minus 2. And bicarbonate is to H2CO3 ratio 20:1. This should be maintained in our body. This should be maintained in our body to neutralize any acid generated inside our body, because if there is acid generated, that is very dangerous for our body. So our body try to regulate acid. If they generate inside our body, try to neutralize by buffering system. Okay. Next is buffer. Buffers are the solution which resist change in pH. Understand? Acids, bases, weak acids, the acids which ionize incompletely. Decide whether they are strong acid or not. Weak acids, they ionize incompletely, like carbonic acid, partial dissociation. Strong acids mean they dissociate completely, like hydrochloric acid, they dissociate hydrogen ion and chloride ion. These are all very hot topic for Viva. Understand? Next, dissociation constant. Here, dissociation of acid is a freely reversible reaction. So at equilibrium, the ratio between dissociated and undissociated particles are constant. Like this is acid, the dissociation into hydrogen and anions. Dissociation constant denotes Ka and it denotes hydrogen into anion divided by Ha, acid. Already you discussed in previous classes. This is one important equation. Everyone should remember this equation. pH is equal to pKa plus log of base by acid, where pKa is equal to pH, where acid is half ionized. Okay. When the concentration of base and acid are the same, the pH is equal to pK. That is, when acid is half neutralized and then generate salt, that means acid is to salt 1:1. When the acid is half ionized, pH and pK have same value. This is one of the most important equation. Everyone should remember this. Henderson and Hasselbalch equation. Okay. Next, by this equation we can calculate what is the pH. Example, if we plot the pK value of of H2CO3 which pKa is 6.1 and log of base bicarbonate normal value is 24 put here and H2CO3 1.2, then log by after calculation pH will come 7.4 in our body. If any confusion, go for your textbooks. Okay. In case of bicarbonate buffer, there is metabolic regulation. pK of carbonic acid is 6.1. I put here 6.1. Normal plasma value of bicarbonate 24. I put here 24 here. Okay. And carbonic acid H2CO3 is 1.2 millimole per liter. This is concentration. Understand? 24 by 1.2 log of this log 20 is equal to come 120. You know better than me because I was forgotten. 20 years back I studied. You come freshly. Logarithm. So after the calculation, this come 7.4. Okay. So by this equation, we can calculate pH. Understand? This is called Henderson-Hasselbalch equation. Okay. Buffers, I have already told the solution will resist change in pH. What is buffering capacity? The amount of acid or alkali after addition in a buffer solution, it changes pH level up to 1. So example on buffer is 7.0. Understand? 7.0 buffer. Say example, in this buffer I added 3 gram of acid and then it become 6.0. So buffering capacity is 3 gram by that particular acid. So if you increase this buffer, say example I add 2 gram of NaOH, then it is called capacity is 2. Example buffers like bicarbonate buffer, phosphate buffer. Okay, these are buffers. Next, this is one of the most important slide. In our body, we have 3 types of buffers: blood buffer, respiratory system. This system regulate a buffer. They change. They regulate the pH in our body. This is first defense mechanism by blood buffer. Second is by respiratory system, and third is by renal mechanism. How does they do? Blood buffer, 3 types: bicarbonate buffer, phosphate buffer and protein buffer. Bicarbonate is CO3 minus by H2CO3. Carbonic acid and bicarbonate buffer. Phosphate buffer, disodium hydrogen phosphate by sodium hydrogen phosphate. Ratio is 4:1. pK value 6.8. Protein buffer, important example albumin, hemoglobin, because they have imidazole group and pK value of this 6.1. Bicarbonate buffer, H2CO3 pK value is 6.1. Okay, these are bulk buffer. I already discussed in previous classes. Already discussed. Alkali reserve means bicarbonate represents the alkali reserve and it has to be sufficient high to meet the acid load. If it is too low to give ratio of 1, all bicarbonate would have been exhausted within a very short time and buffering will not be effective. So under physiological circumstances, the ratio of 20, there is high alkali reserve, ensures high buffering efficiency against acids. This should be maintained. We can ask you in the Bible exam, what is alkali reserve? Phosphate buffer, it is mainly an intercellular buffer. Its concentration in plasma is very low. The pK value is 6.8. So applying the equation, we can calculate this pH. Anti-log of 0.64. Only written in this is also important. Next, hemoglobin buffer system. This is very important. You can come in short note in exam. How hemoglobin acts as a buffer. Hemoglobin buffer system handles the major acid load of volatile acid, mainly carbonic acid. Plasma proteins have only 1/3 of buffering capacity of hemoglobin when compared by weight. Hemoglobin accounts for 6 times the capacity of buffer H+ ion when compared to plasma protein buffer capacity of non-bicarbonate buffer 60 millimole per liter, pH 7.2. When hemoglobin is oxygenated, hydrogen ions are released in lungs, and on deoxygenated, hemoglobin binds hydrogen ion in tissue. Next is respiratory system. The respiratory system works by ventilation, either hyperventilation or hyperventilation. If there is acidity, then body try to remove carbon dioxide to lower the level of H2CO3, bicarbonate, carbonic acid. All of you know bicarbonic acid is a weak acid. It can dissociate into H+ ion and bicarbonate. By exhaling excess carbon dioxide, that means we lowering H2CO3. By this way, H+ ion generation decreases. Okay. In the opposite, when there is alkalosis, body try to retain carbon dioxide. Okay. When there is a high carbon dioxide, that means there is high level of H2CO3, carbonic acid. Eventually, carbonic acid broken down into H+ ion and bicarbonate. By this way, our respiratory system can work. Understand? Very simple. In hyperventilation, there is hyperventilation of PCO2. In acidosis, that means when pH less than 7.35, lungs try to blow out carbon dioxide. It represents dissolved carbon dioxide in the form of carbonic acid. See here, water attached with carbon dioxide in the help of carbonic anhydrase enzyme. It forms carbonic acid. This carbonic acid can dissociate into bicarbonate and proton, hydrogen ion in acidosis. By this way, more hydrogen ion generated. In alkalosis, the opposite occurs. Lung try to retain carbon dioxide. Here, see, same thing happening. Carbon dioxide react with water, forms H2CO3 by help of enzyme carbonic anhydrase. Then again H2CO3 dissociate into H+ ion and bicarbonate ion. Okay. This thing happens during alkalosis. The hemoglobin in tissue level generate carbon dioxide. All of you know in tissue there is high level of carbon dioxide. This carbon dioxide combine with water and then convert into carbonic acid by the enzyme carbonic anhydrase. This carbonic acid generate H+ ion. This H+ ion neutralizes by hemoglobin and form reduced hemoglobin HHB. Then this reduced hemoglobin by the way circulation reaches in lung. While in lungs there is high level of oxygen is there. In lung, this reduced hemoglobin react with oxygen and form oxyhemoglobin and releases hydrogen ion. This hydrogen ion react with bicarbonate and form carbonic acid. This carbonic acid then broken down by the enzyme carbonic anhydrase and form water and carbon dioxide. And this carbon dioxide blow out from by expiration. Understand? Very simple thing. If you understand this concept, then it is very easy to understand everything. Very simple thing. Just go to your textbook and understand this concept. Very simple but very, very interesting. If you write this thing in your exam, you can get full mark. Don't have to write lot of things, this thing. Just write this concept. Okay? In renal, kidney regulate acid base by 4 ways. These are 4 ways. First way is to excrete hydrogen ion. Second is reabsorption of bicarbonate. Third is excretion of titratable acids. And fourth one is excretion of amide ion. Understand? Here, these 4 things beautifully diagram is there in Vasudevan. Everyone should read this and understand this. Very simple thing. How express ion excreted by a kidney. Here, in proximal commotary tubule, there is generation of carbonic acid. This dissolves into express ion and bicarbonate. Bicarbonate is reabsorbed in alkali region in plasma, and express ion is excreted in tubular lumen. Then it is excreted via urine. This is the reason in a normal person urine acid is low, pH is low, less than physiological level. There is around 6.0. Okay. By this way, hydrogen ion is excreted. Next one is reabsorption of bicarbonate. Here you can see in tubular lumen, this sodium bicarbonate is filtered out. Then again broken down into sodium ion and bicarbonate. Sodium ion is actively reabsorbed in the tubular cell, and again it reabsorbed in plasma, where bicarbonate is react with excreted sodium ion and form carbonic acid. This carbonic acid broken down into carbon dioxide and water by the way active enzyme carbonic anhydrase. This carbon dioxide is reabsorbed in the tubular cells, and here it can again form carbonic acid and broken down into bicarbonate and H+ ion. This bicarbonate is actively reabsorbed in alkali region in the plasma. Understand? Very simple thing. By this way, kidney preserve bicarbonate. Next one is excretion of titratable acids. Here you can see in tubular lumen, here it excretes disodium hydrogen phosphate, and it dissociates into sodium ion and sodium hydrogen phosphate ion. This ion is react with excreted H+ ion and forms sodium dihydrogen phosphate. Its pH is very low, 5.4, and it excreted via urine. By this way, titratable acids are excreted. And next one is excretion of amide. Here you can see in the tubular cells, here comes ammonia, the broken down product of glutamine by the enzyme glutaminase, and glutamine forms glutamic acid. and ammonia is excreted in the tubular lumen where it bind with H plus ion and forms amide ion. So H plus is trapped and excreted. By this way, amide is excreted. Understand? So this is a 4 simple diagram. Everyone should read and understand this. Okay? Any question? No question? So now come to disorders. There is 4 type of disorder of acid base and pH. First one is metabolic acidosis, metabolic alkalosis. Respiratory acidosis, respiratory alkalosis. Okay. So in metabolic acidosis, here pH is low, less than 7.35, and bicarbonate is low, less than 22. And alkalosis, pH will be more than 7.45 and bicarbonate will be more than 26. In respiratory cases, pH would be low and PCO2 would be more than 45 millimeter mercury, where respiratory alkalosis pH would be more than 7.45, where PCO2 would be less than 35. Understand? Look at this diagram. When you interpret a acid base disorder in a ABG sample. Achha, one thing I forgot to mention. What is the sample? From where you get the sample to analyze acid base in pH? Anyone? Don't know? That is arterial blood gas. Arterial blood gas analysis. ABG. How can I do this? We take a heparinized syringe. Okay? A syringe is there. It is pre-filled with some amount of heparin. Heparin. What is heparin? It is an anticoagulant. Okay? And then we select the artery site, probably from this radial artery, and then take a amount of blood from artery, and then we analyze in a ABG machine. ABG, arterial blood, heparinized artery, heparinized blood is taken. Then it's analyzed in a ABG machine. ABG machine. If a sample is given, if a result is given, arterial blood gas analysis sample is given to you to interpret, then first of all you have to see the pH. I am telling you, listen carefully. How can you analyze a ABG report? When a report is given, first of all you see the pH below. Understand? First of all, you have to see the pH below. What is the pH value is? If it is low, that is called acidosis. If it is high, that is called alkalosis. If it is normal, would be no abnormality, or maybe there is mixed acid base disorder. You can understand this thing right now because this is in advanced part. When you become mature enough in final exam, final MBBS, then you understand easily. Right now, just listen carefully. How can we interpret? Because this kind of question may ask in your exam. Okay, like this one question may ask you in the exam. In a case, 5 marks. I am telling you later. Just right now, focus here. Please focus here. You have to see the pH value. If it is low, there is acidosis. Then you go for what is the how it is pH is where towards going. It is high PCO2, then it is respiratory acidosis. If it is low bicarbonate, there is metabolic acidosis. Understand? First of all, you see the pH, then go for bicarbonate and PCO2. If the bicarbonate level is low, there is metabolic acidosis. If PCO2 is high, there is respiratory acidosis. Simple thing. Understand? Okay. First of all, you see the pH value. Understand? Then you look for bicarbonate and PCO2. If the bicarbonate level is low, then you can diagnose this is a metabolic acidosis. If the PCO value is high, then respiratory acidosis. Simple thing. Then say you receive another sample where you look for pH value. There is pH value is high. So immediately you can strike in your brain that in this case of alkalosis. Then go for bicarbonate value and PCO2 value. You see that. If the bicarbonate value is high, then it is called metabolic alkalosis. The PCO2 value is low, then it is respiratory alkalosis. Understand? Simple thing. Right now, if you understand this concept, then it is enough for you. Again telling you, this is one of the most difficult thing, confusing thing, but very simple thing. If you understand this, then it is very easy for you to understand throughout your life. Understand, Tanvi? Okay. So we have 4 types of disorder. First one is metabolic acidosis. Here pH value is low, bicarbonate value is low. Next, here it is written as due to primary deficit in bicarbonate, resulting in accumulation of acid or depletion of bicarbonate. When there is excess acid production, bicarbonate is used up for buffering. Depending on the cause, the anion gap is altered. Next come anion gap. What is anion gap? In our body, we can measure only 4 things in our laboratory routinely. Sodium ion value, potassium ion value, and we can measure chloride value and bicarbonate value. The difference between them, there is called anion gap. Understand? Say example here. Say sodium value is 140, potassium value is 4, chloride value is 105, example 505, and bicarbonate is 25, example. So what is the result? Anyone? Calculate immediately. কত আছে বলো, তাড়াতাড়ি বলো। 144 minus 130, that is 14. Am I right? Am I right or wrong? Okay. Our value is 12 plus minus 2, that is 10 to 14. Understand? That is everything written here. The sum of cation and anions in extracellular fluid is always equal. So as to maintain the electrical neutrality, sodium and potassium together accounts for 95% of the cation, where chloride and bicarbonate accounts for 86% of the anion. Only these electrolytes are commonly measured. Hence, there is always a difference between measured cations and anions. The unmeasured anions constitute the anion gap. Okay, here is 14 difference. So this is called anion gap. समझ गए everyone? बुझते पारले? समझ गए ना? Here is cation level is high. Understand? Cation value is high, but anion value is low, because we can measure only cation and anion in limited amount in our laboratory, routine laboratory. Say here sodium and potassium we can measure very easily in laboratory. Even chloride and bicarbonate we can also measure by ABG. Understand? समझ गए ना? अच्छा, इसके बाद मान के चलो आप मुझे ए मिला, सोडियम मिला 140, पोटासियम मिला 4 मिला मुझे, ठीक है, क्लोराइड मिला मुझे 105 और बाइकार्बोनेट मिला 25. सो इफ यू एड दिस, से कैलकुलेट दिस, इट विल कम 14. लेकिन तो इक्वल होना चाहिए ना, सोडियम पोटेशियम शरीर का अंदर इक्वल होना चाहिए, बट वी कैन मेजर ओनली दिस थिंग्स. दैट इज कॉल्ड एनायन गैप. समझ गया ना? बट समथिंग इज देयर इन योर बॉडी दैट कैन न्यूट्रलाइज. दैट इज कॉल्ड unmeasured anions. What is that? Remember PSPO. So unmeasured anions, remember PSPO. PO. This is a mnemonic. PSPO. P means phosphate. Phosphate. S means sulfate. Sulfate. P means again protein. Anionic protein. Anionic. N is O means organic. Organic acid. PSPO. These are unmeasured anions. PSPO. P means protein, phosphate, sulfate, phosphate, sulfate, again anionic protein and organic protein. Anionic protein and organic acids. Organic acids. समझ गए ना? So we can ask you in the exam, what is the normal anion gap? Everyone should answer this. What is normal anion gap? 10 to 14 millimole per liter. Okay. What is the unmeasured anions? Remember PSPO. P means phosphate, sulfate, anionic protein and organic acids. Okay. Next come high anion gap metabolic acidosis. You may ask in the MCQ. Again I am telling you, this is a very hot topic for PG entrance exam. Even every year 1 or 2 questions come asked in the PG entrance exam. If you want to be a MD doctor, they have to remember this topic. Simply, सब बातें ये आपको पढ़ना ही होगा, बहुत इंपॉर्टेंट टॉपिक है. Here you can see this list. Here you can see high anion gap metabolic acidosis. For example, like renal failure, sulfuric, phosphoric organic ions decrease ammonia ion formation. Please go through this table. I have taken from Vasudeva. Some drugs like furosemide, nitrates, salicylate, methanol poisoning, organic aciduria. These are high anion metabolic acidosis. Next come normal anion metabolic acidosis like diarrhea, intestinal fistula, renal tubular acidosis, carbonate emphatic inhibitors like loss of bicarbonate, uterosegmentostomy, drugs like antacids. Example. These are example. Everyone should read this table. High anion metabolic acidosis, normal anion metabolic acidosis. Okay. Next come metabolic alkalosis. Here pH value is more than 7.45 and bicarbonate value is more than 26. Okay. Example. Any form of acid loss from our body, like vomiting. Okay. Hyperaldosteronism causes retention of sodium and loss of potassium. Hypokalemia is closely related to metabolic alkalosis. One thing I forgot mention to forget, in acidosis there is development of hyperkalemia. Why? In acidosis there is high level of proton in your blood. This proton exchange with potassium present in intracellularly in very high amount. So proton go inside the cell and potassium come out from the cell. So in metabolic acidosis there is hyperkalemia. In the opposite thing happens in alkalosis. There is high level of potassium outside and okay. So this thing can alter. Both hyperkalemia and hypokalemia are dangerous for our body, especially for heart. If you do not diagnose and treat promptly, patient may die. So in our body, in extracellular space, potassium level is regulated tightly by our body. ठीक है ना? So just remember this, what is metabolic acidosis, metabolic alkalosis. Then just remember one or two example. Alkalosis present hyperaldosteronism. Okay. Excess vomiting. Vomiting causes loss of acid. Next come respiratory alkalosis, acidosis. So go for example. In respiratory acidosis, there is pH level is low and PCO2 will be high. Example COPD, severe bronchial asthma, okay, bronchopneumonia. They retain carbon dioxide in our body. Understand? Respiratory acidosis, there is retention of carbon dioxide. Example COPD, bronchial asthma. COPD, pneumonia, etc. COPD, bronchopneumonia, bronchial asthma, these are example of respiratory acidosis. What is alkalosis? Where carbon dioxide wash out. Example, hysteria. When I was working in PHC, I seen some patients come to emergency sometimes by the family members. They told me my girl is suffering from respiratory distress. Okay? Even I can say in your life, practice life, you can face this kind of patient in your life. Patient come to you, especially young lady, especially some students, they have some exam is coming. Say most common thing is mathematics exam. Understand? They then told that my girl is suffering from respiratory distress. That I told like, you go examine the patient till everything is okay, being confused. What is going on? समझ गए ना? That is called hysteria. ठीक है ना? हम लोग उसको कहते हैं क्या? Functional disorder. In short form, we also tell them FND, functional disorder. FND. This kind of patient often suffering from respiratory alkalosis because of voluntary excessive respiration. Hysteria. Okay. So hysteria is one of the commonest thing. Remember, next common thing is when you go above, what happens? Oxygen level decreases. Hypoxia, mountain sickness. Okay. Here you get respiratory alkalosis. Understand? Look at this question. A patient with chronic obstructive pulmonary disease was admitted with respiratory infection. COPD patient come to you with respiratory infection. Then patient get admitted in a ICU. Here you done ABG. The result say pH is 7.2. That means what? Acidosis, alkalosis. You tell me. Acidosis. Say loudly. Acidosis. Then what would be the next step? You see the level of bicarbonate and PCO2. What is bicarbonate PCO2? PCO2 is 65 and bicarbonate is 32. pH is low, bicarbonate is high. That means it is going towards respiratory acidosis. Okay? Your diagnosis would be respiratory acidosis. Bicarbonate is 32, they may be high. So body try to neutralize this acid. Is going towards compensation. Okay? So your diagnosis would be uncompensated respiratory acidosis. Uncompensated respiratory acidosis. If the pH, say now tell me pH is 7.4 and this is the result, what will be your diagnosis? Compensated respiratory acidosis. Okay. So this is a question. You may get lot of questions like this. One or two questions. I can surely say you in your exam you can get one type of question. So go and read this very carefully. This is one of the most important topic I am telling you again. In your exam purpose, even in future lecture classes like medicine, pediatrics, anesthesia, ICU, everywhere you get this kind of cases. Even in PG entrance exam, you get this kind of one or two questions. Okay. So this is a question I taken from Vasudevan. If you want to see and go for Vasudevan. So what is the acid base stage of the patient? Now tell me. What is the acid base status of this patient? pH is low, that is acidic. Base is what? PCO2 is high and bicarbonate is high. Next, explain the role of buffer in this regulation of acid base balance. We already discussed. What is the role of lungs in regulation of acid base balance? We already discussed. Enumerate the primary changes and secondary compensatory changes different type of acid base disorder. So, say you get a metabolic acidosis. Here, body try to neutralize the acid by respiratory system. If you get metabolic alkalosis, body try to compensate by respiratory acidosis, respiratory system. If you find respiratory acidosis, body try to compensate by metabolic alkalosis, by bicarbonate. In respiratory alkalosis, body try to compensate by. Very good. Understand? Very simple thing. Okay, thank you for listening.